we have heard a lot that Medicare is not sustainable, that the cost of healthcare is ballooning, that it is pushing other programs out of the way because it's taking up more and more of the pie, that there are better alternatives. Raise your hand if you have heard any of these claims about Medicare. I think every single hand appears to be raised, so you guys have your work cut out for you today, because these guys say that Medicare is sustainable and that there are a number of myths that we are hearing perpetuated by politicians, by the media, we know what types those are, and by interest groups. And so today we're going to address some of those myths and arm you with information so that when the issue of whether or not healthcare or Medicare is sustainable comes up in your workplace or even outside of your workplace, you'll be armed with the tools and the facts and the figures to have a discussion about that.
The campaign against Medicare has gone through a few phases. Really started with the deficit mania, you remember under Mulrooney and that sort of period, moved into, after the deep cuts, the $32 billion cut in the mid-1990s, compounded by the provincial tax cuts, moved into taking over some of the work that we were doing to show Canadians the horror stories that ensued in their hospitals, and use those to say that the public health care system wasn't working. Irony of all ironies, the same forces that promulgated the tax cuts and the huge cuts to social services then blamed the public health care system for those cuts. And of course, what did they recommend? Well, the only thing they ever recommend, privatization in their own interests.
Expenditure over GDP, public expenditure, has gone down sharply, and that in a nutshell is why you keep hearing these stories about healthcare spending taking up, public healthcare spending taking up a larger and larger share of our fiscal capacity. The reason is because we've been reducing our fiscal capacity a lot. That's what happens when you hold healthcare spending relatively constant, pink line, and you dramatically slash all other forms of spending. A little bit of grade 5 arithmetic will tell you that the ratio climbs. But it doesn't mean that the healthcare system is running away with the farm. It means that you're slashing everything else, that's all. But that's, when you're cutting your taxes, you are in fact reducing the amount of public money available. And if healthcare spending is staying, reasonably controlled, it's going to go up as a share of the total. This is what happens, however, when you take that last slide, expenditure per person, inflation adjusted, and you deflated by the GDP. And you can see that, yes, it's climbing, and it's climbing again in the recession, but it's gone way down in the past. There are ways of containing expenditures, and it's not that different from where it was at the beginning of the period. So that's for hospitals. It is up for drugs, way up. It's up for doctors, somewhat. But for hospitals, it's back where it was at the beginning.
Is it true that we are collectively spending more and more on Medicare? Well, unfortunately, it is true. It's not a big deal, but we are collectively spending a little bit more each year on Medicare as a proportion of our collective wealth. This probably is the bad news. There are two good news that should be kept in mind. The first one is that this growth is actually very slow. The second one, and it is more important, is that we're not alone on that path. For what I know about the statistics, no rich country anywhere in the world is spending less and less each year. Every single rich country is having to deal with increasing spending in healthcare.
It's not healthcare that's eating provincial budgets. In fact, it's tax cuts that are eating provincial budgets. And as Robert Evans showed you in the early set of slides, it's easy to look like a bigger fish if the pond around you keeps getting smaller. And so that line that shows healthcare expenditure, of course, becomes a greater proportion of provincial budgets if you keep reducing your fiscal capacity.
the right-hand side, that's the stuff going up too fast. That's, again, the same thing I was showing you. You sort of look at costs per capita, deflated by inflation. But notice that the rapidly increasing lines, hospitals is moving up too, are drugs, green line, and doctors, red line. Those are the ones that are going up recently, and most of that is increase in prices. It's not increase in services, it's not increase in, health for people.
I want to draw your particular attention to drugs in the 1975, which consumed 8.8%. I want to be open and say, physicians were 15.1%. This is of the total pie that existed at that time. That pie is larger now, but it's been rejigged. The proportion of drugs has now gone up to 16.4%. The proportion of drugs has actually exceeded the proportion that goes to physicians. And that represents a huge explosion of growth. On the other hand, the hospital sector, your brothers and sisters, has shrunk as a proportion. And that's important to keep in mind.
Spending are not God creation. We are collectively making decisions. And some of those decisions do have sense, in my own opinion, about the fact that when you have new technology that are proved to help people's life, to diminish suffering, or to cure things that we're not able to cure, well, maybe collectively it does make sense to spend a little bit more to have access to those technology. But those technology are very few. Lots of what we're spending is on, well, maybe not useless, but disputable technology. We have the tendency to fund high-tech, third-line hospital with very expensive technology that don't seem to save that much lives. We even have the tendency to not study this at all. We are very poor throughout Canada in having statistics about the efficacy of different treatment, and we spend collectively a huge amount of resources in unproven technology.
But within healthcare, and I think a bunch of the speakers alluded to this, there are also, I think, legitimate fights about where the money is going. And drugs, I mean, within hospitals, for example, and hospitals are always on the front line of cuts, but within hospitals, the growing costs are medical equipment and supplies, drugs, and medical gases. All of those things are dominated by the private sector. The employees, the nurses, the support staff, et cetera, have been shrinking as a proportion of hospital budgets, and that's been the case for years. So within the healthcare budget itself, there are areas where we are seeing costs that are growing vastly, that are not necessarily connected to improving people's health.